And new concerns today about how Obamacare will affect your medical options and your health. Many doctors are simply opting out, and reports that many people will no longer have access to some of the nation's best hospitals, including 2 top cancer treatment centers. Dr. Sreedhar Potarazu is CEO of Vital Springs Technologies. Dr. P, thanks so much for being here. So if you can't have access to the best hospitals for treatment, what's the point of having coverage?
Well, that is a real problem. You know, Allison, having been on the faculty at Johns Hopkins for several years, many years ago, I can tell you that a lot of these centers for excellence are typically very good in terms of taking care of people with complex problems and very sick people. And if you look at the kind of people that are signing up for insurance within the marketplaces, it is the people with more chronic illness who need more sophisticated care. Now, it costs a lot more money to provide care for these people, and that's why a lot of these major hospitals are choosing to opt out or limit the number of plans that they're going to participate with. Now, how does that play out? The sick people that really need the best care end up not getting access or having to go to a suboptimal doctor or facility that doesn't have the expertise. And then what happens? If they really need care, they end up in the emergency room, which really is a boomerang effect from what the intent of trying to lower costs is with the Affordable Care Act.
We're right back to where we began if you have to go to the emergency room. And the places that you're talking about are really almost household names. Everybody across the country knows these. Memorial Sloan Kettering in New York City, MD Anderson Cancer Center, Stellar Operation in Houston, Mount Cedars-Sinai in Los Angeles. So wasn't the point of Obamacare for more competition? Why does there seem to be less competition?
There's less competition because there are less number of insurance companies, number one, that are participating in some of these marketplaces. And the second is that everybody is fearful of the risk pool of people that they have to insure. So the immediate mechanism is to what's called narrow the networks and the number of options in order to keep the premiums down. Eventually, though, it's going to be impossible to keep premiums down if that risk pool remains the same, as younger people are very adamant and somewhat reluctant to sign up right now for Obamacare.
Okay, so beyond these top-tier hospitals and cancer centers, let's talk about doctors and their participation in Obamacare. There is a report out that an estimated 7 out of every 10 physicians in California is opting not to participate. Yeah. Why?
Because, number one, the reimbursement rates, especially in California, are about 30% less than other parts of the country. And so many doctors are saying, look, we can't really afford to take on the risk pool of people that you're asking us to take on with an increased volume and still stay in business. So it may be more profitable for some doctors to either opt out of Medicare or Medicaid and rely on either a concierge service or restrict the kind of practice that they're actually going to carry forward. But you're going to see a growing trend again. Now, the flip side of that is many doctors are not even aware whether they're within the networks of certain plans, and consumers are going to find it difficult to find out if their doctors are in the plans, and sometimes it takes them having to call the doctor's offices to figure out, which is going to be very cumbersome.
Right, much more time consuming. Okay, one last thing, one last development today that we need you to comment on, another troubling one. Many drugs won't be covered under the Affordable Care Act. Why?
So getting brand names and specialty drugs has always been a challenge for consumers, even within employer-sponsored health insurance. Now, if an individual that buys insurance off of the marketplaces, they need to know whether the insurance company's formulary is going to cover those particular drugs. So imagine you've got to find the plan that covers all of your drugs and find out if they have the right formulary. You've got to figure out whether your doctor is within the plan. I think instead of training navigators, they're going to have to start giving consumers PhDs to navigate these marketplaces because it's very complex and the information isn't available. So what's going to happen is they're going to pick a cheap plan and then later on figure out when they really need to go see the doctor or get the prescription filled, oh my God, it's not covered. Right. Then what?
Right, just the very time that level of confusion. Dr. Potarazu, thanks so much.